Respiratory assessment, take one. Knock, knock, knock.
Man,
Hello, I'm Julie. I'll be your nurse today. Gonna wash my hands and provide privacy by shutting the door. Oh, could you state your name and your full date of birth, please?
Fred Jones, 5/16/1929.
Okay. Let's see. Hand hygiene, privacy, identifier. Oh, I have a stethoscope and a timer and an alcohol pad. Rip, clean, 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 cleaning the stethoscope for the patients. Um, uh, now, I'm going to ask, today we're going to do a respiratory exam to find out if you have any breathing problems or problems with your, your thorax or your chest area, um, to kind of establish a baseline. And yeah, if there's any problems with breathing, etc. Mostly you're just going to sit here. I might have you turn around for the camera. I'm going to be palpating and percussing, and that's not going to hurt. And using my stethoscope to listen to your breath sounds. And mostly you'll just be sitting down through the entire exam. I hear you have a little bit of a cough. We'll talk about that in just a little bit. So do you have a cough?
No.
No cough, huh? So you just had to clear your throat there for a
Clear my throat.
Okay. Do you smoke?
No.
Have you ever smoked?
No.
Okay. Have you gotten your flu shot this year?
Yes.
Oh, good. Okay. Do you have any chest pains or trouble breathing?
No.
Okay. Okay. Um, Now, what I like to do is start in the back with the after I do an inspection. So I'm gonna have you turn around in a little bit. But first of all, I'm doing the inspection. I'm looking at the chest to see any asymmetry or um, if there's any barrel chestedness. Um, I'm comparing the diameter of the transverse diameter with the anterior posterior diameter, and it seems normal. In the back, I'm seeing the normal sloping of the ribs. The scapula are symmetrical and normal. No, stop. And I'm not seeing any discoloration or lumps, and there's no moles back here to worry about, so I'm not going to talk to him about his moles. And he is sitting normally and comfortably. He's not having any labored breathing. He's not using any accessory muscles when he's breathing. He's conscious, fully conscious, and yeah, he's not drifting in and out or anything. He's here, and what was the other one? Posture. Yeah, his posture's good, so he's not having to lean over to breathe. He can breathe normally. And consciousness. Then we'll get back to that if I forgot anything. I don't think I did. So I'm going to have you sit like you're sitting, but turn around so your back is facing the camera. All right, the first test I'm going to do is symmetrical chest expansion. So what I'm going to do is put my hands back here and pinch in and ask him to breathe in deeply. And I'm seeing my thumbs come out about a centimeter on each side as he's breathing. So and it was symmetrical, so symmetrical chest expansion. I'm going to test for vocal fremitus or tactile fremitus, which is vibrations when he says 99 to test, um, well, to test for symmetry on both sides to see if there's any abnormalities. So if you say 99,
99,
99,
99,
99,
99,
99,
99,
99,
99,
99,
99,
99,
99,
99,
99,
99,
99,
and then 99.
99.
Okay, so that was good. Now I'm going to palpate to see if there's any lumps or tenderness or swelling or any problems with his ribs, etc., etc. So you tell me if you feel any tenderness or, and I'm not feeling any lumps, no swelling. Tell me if you feel anything hurting. No pain?
No pain.
No, okay. So I'm not feeling any abnormalities with the palpation all the way down and on the sides. Okay, so now I'm going to do percussion. Percussion, there's 22 spots to do. I think you said not to do all of them because it would take too long. But what I want to say is that there's 3 up here, 1, 2, 3, 1, 2, 3, and then you would go across and down at each of the intercostal spaces, but not over the scapula. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, and then you kind of curve around the scapula, well, and then you so 16, 17, 18, 19, 20, and then 21, 22. So you do like a snaking motion in the intercostal spaces down here, and then so I'm going to do some, and this is how you tap on there and use a stinger. So I'm gonna, it has to be above the clavicle. So, and I'm listening for resonance. And then the same, let's see here. And you listen on each side for, so you kind of check one side versus the other in a pattern down the back. And what I'm hearing is symmetry, and you do that all the way down. Okay, so now we're going to go move to the front and do the same thing on the front. We're going to oscillatate last. So the first thing I'm going to do is the expansion. So I'm kind of feel down for the xiphoid process, and I'm going to pinch and I deep breathe, and I see my thumbs spread out equally on both sides, so I see symmetrical expansion. We're going to do tactile trembiness in the front on 8 different spots. So we want you to do 99.
99.
And then 99.
99.
And then 99.
99. 99. 99. 99. 99. 99.
Okay. So I kind of hear it more up here and less as I go down. Or, I mean, feel it. Feel the fremitus. Okay, now I'm going to palpate for any masses or lumps or tenderness. Tell me if you feel any pain. Okay. I'm not feeling
Okay.
any swellings or abnormalities in the chest. Okay, so now I'm gonna auscultate. I'm gonna have you turn around for the camera again because I'm gonna start in the back. Otherwise, I wouldn't have him go back and forth like this, but for the camera, I am. So, listening for breath sounds, um, you do 18 spots on the back, um, avoiding the scapula, and you have to start way up here above the clavicle because that's where the lungs begin, way up here, and you kind of do a snaking pattern down the back in 18 different spots, and then as the scapula, I mean that right here, as the scapula comes around, then you kind of come out here and listen to those lobes out under the scapula. So I went down too far actually, but you go up like that. So I'm going to listen, and every time I move the stethoscope, I'm going to have you breathe in and out through your mouth, but not too deeply, but just a little bit more than you usually would. Okay? So breathe, 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 breathe. Okay. So and on down the back, making sure that I come up here and make sure I get these areas here. So it would be 18 different areas. Okay, so turn around for the camera. Not that you would normally. And we're going to auscultate. Let's see, it's 10 areas in the front. I'm looking for, here's the clavicle. So I'm going to start above the clavicle because the apices of the lungs are up here. And we're going to do the same thing. Breathe, breathe in and out. 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 And then, so we're going to do 10 spots and end up down here, just below here. So, if he had any abnormal breath sounds, he might have crackles, which would be tiny little popping noises that are indicative of maybe the bronchioles popping open when fluid is clearing, or the alveoli popping open, um, expanding, um, and or wheezing, which is a kind of a musical note on usually on the expiration, or rhonchi, which are coarser sounds in the lungs that kind of sound like snoring in the lungs, or absence of breath sounds or diminished breath sounds. And I didn't hear any of those in comparing one side versus the other. Other exam, just a moment. Other exam that you can do with the stethoscope um, to test for areas of the lungs that are abnormal, like with consolidation, or bronchophony, egophony, and whispered pectriloquy. And what you do is, if you kind of noticed in your early exam that there might be areas of concern, you would listen to the various areas and ask the patient to say, with the stethoscope, say 99. And if it's muffled, that's a normal bronchophony. That's a negative bronchophony sign. It can be louder, which would indicate areas of consolidation, like pneumonia, and then quieter if there's areas of just air, like emphysema or pneumothorax. And then the same for the whispered pectriloquy. You shouldn't hear that at all. If you can hear it, then there's probably areas of consolidation. And also the what was the other one? Egophony. If you say, if the patient says E, and you have the stethoscope on the trouble spot, and it turns into the ah sound, that's also indication of that there could be area of consolidation, like pneumonia or pleural effusion. During my talk here, I counted the respirations, and his respiratory rate is 14 breaths per minute. So, everything's normal with you today? You had no lung problems? Do you have any questions?
No.
No? Okay. I'm going to document my findings, and that's it. Thanks. Okay.